it's Dr. Connie Casebolt. I'm at Forum Health Greenville, and today I'm going to discuss some very important tests. So there are some offices where they may do more guessing, but we like to say we don't guess, we test, because there's a lot of testing that is asymptomatic. You can't tell whether your level is good or too low or too high, so we have to test. So what are the most important tests that we need to do on at least an annual basis to make sure that we're in the optimal zone? We're going to start with hormones. That's something we all lose as we get older. Women, of course, lose all their hormones at menopause. Men often gradually lose their hormones as they get older. So why hormones? Because having optimal hormones is incredibly important. Keeps your brain from shrinking. It keeps your skeleton from shrinking so you don't get osteoporosis and lose height. Keeps your immune system healthy. Keeps your heart healthy, your digestive system, so many things. Not to mention, of course, sexual function. So we want to keep our hormones at a healthy level. So check hormones. Second on the list is thyroid. Many offices today are only checking a TSH, or maybe a TSH with the addition of a T4. This is completely inadequate. The TSH is good, we need that. T4 also, but we need to check a T3. And if any of those are abnormal, we need to start checking a few other things. Thyroid antibodies, a spot urine iodine, selenium levels. These are all important things to check so that we get the full picture of where you are with your thyroid health and what we can do. Next on the list, vitamins. There's some key vitamins that we have to know are optimal, and those are vitamins D and B12. We see deficiencies in these every single day. Depending on symptoms, we may add some more vitamins such as B6. Low B6 can be implicated in having a high homocysteine level or anxiety disorders, maybe a few other things. So we might add some vitamins to the list, but always vitamin D and B12. When it comes to minerals, some more important things. We always check a ferritin level, and surprisingly, ferritin, which indicates iron, whether it's too low or too high, ferritin is more often too high than it is too low. And this presents a problem because having a high iron level, which is a high ferritin level, is actually associated with higher risk of heart disease, diabetes, cancer. These are not good things. So just like Goldilocks porridge, all of our lab values need to be optimal, just right, not too high and not too low. In some cases, we might check zinc and copper. So these are two more minerals that could be very important. I've already mentioned selenium and iodine in the thyroid context, but if we're talking minerals, that would be in there as well. Another important test that very few doctors are measuring is homocysteine. So homocysteine is a product of the metabolism of methionine. Methionine is an amino acid that we eat in our diet, and it turns into homocysteine. Why is homocysteine important? Because it's a risk factor for hypertension, heart disease, dementia, macular degeneration, and a few other things. And there are no symptoms to having a high homocysteine. So it's just another lab value that we wish to optimize. Another one on our list is C-reactive protein. We abbreviate this CRP. So C-reactive protein is a non-specific marker for inflammation. And having low inflammation levels is really important to overall good health. And as I mentioned, it's often without symptoms. So if we see a high CRP level, we're definitely going to outline an action plan to get that down to a better level. Okay, a hemoglobin A1C along with a fasting insulin. These both give us insight as to how well you're handling blood sugar issues. As we get older, we don't want either one of these to go up. I should also mention a fasting blood sugar. So A1C, insulin, and blood sugar. And again, we can then give you tips on how to change your lifestyle. These can also be influenced by hormone levels, some of the previous minerals that we've already talked about. A complete blood count. Now that's a very common test. Your doctors are probably already checking it, but it does need to be checked at least once a year. That gives us insight into your white blood cells, your hemoglobin, which carries your oxygen, as well as your platelets. a CMP, which stands for Comprehensive Metabolic Profile. That gives us 14 different blood chemistries, including blood sugar, kidney function, liver function, protein, types of protein, electrolytes, calcium. Very important panel, should be done at least yearly. And then if anything's abnormal, we would normally check it again in 3 months. And last but not least, a lipid profile. So it's obviously important also to know what your cholesterol is, because that has implications for your heart health. So I hope this discussion has helped you to understand and realize that we can't not test, we have to test, and that the test results along with your symptoms will help give us a clear idea on how to help you live the longest, healthiest life that you can.